Hi, everyone, and welcome back to Beauty Curious. I'm Michael Crumm, and I'm here with my beautiful co-host, Dr. Elyse Love. I'm super excited to dive into something I get asked about all the time, and I'm sure you do too, Dr. Love. So let's talk about pregnancy-safe skincare.
Hi, and welcome to Beauty Curious. My name is Dr. Elyse Love, and I am a board certified dermatologist.
And I'm Michael Crumm, a licensed esthetician.
Ian and I are excited to become your trusted beauty guides, from interviews with the best and brightest names in the industry to sharing our favorite expert-approved products.
We are here to help you navigate the noise by giving you the facts. Are you feeling beauty curious? Let's dive into today's episode.
When I do my Ask Me Anythings, it's like the number one category of questions that I get. And it makes sense because it's like we go through life and we're like figuring skincare takes forever to figure out. And then you finally figure it out. And then all of a sudden you're like, wait, like, can I use this on my skin? And so, yeah, let's do it. I will
Yeah,
say we are talking about pregnancy, not breastfeeding, because there's a lot more leniency with breastfeeding. So I feel like we should just do like a separate conversation about that later, just so that we can focus in and not confuse
we're
people.
okay. So we're hyper focused on when you're actively pregnant, not breastfeeding.
Yeah.
And yeah, I feel like I'm in my early 30s, and it seems like all of my friends are having babies like they're all having babies. And I think by the 30s, as you said, what are you doing with your skin? You get
Yeah.
into a routine. I feel like by your 30s, you kind of know what you're doing. And then if you get pregnant, it's like a big question mark. Dr. Love, where do we get started? What are the first things to consider when figuring out what's pregnancy safe?
Yeah. So with pregnancy safe, I think when we think about it clinically, there are basically kind of four ways that we think about, is a product safe or not safe to use topically during pregnancy. The first is that it's the holy grail. There are clinical studies that show that this product is completely safe during pregnancy, or we have clinical registries of people who've used the product during pregnancy and there's been no bad outcomes. I say it's the holy grail just because it's extremely uncommon because we don't do clinical studies on pregnant women. So it's really hard to
Mm.
get that data, which is why it can be very confusing and very overwhelming. The second is there's a lot of products where we're saying, like, generally this product is thought to be safe because of either the mechanism or just the fact that it's so broadly used that, and we've never seen any negative outcomes. So, like, one thing you might think of is like vitamin C. Like, that's something that nothing in abundance, but like you can consume quite broadly orally while pregnant. And so, like, adding vitamin C to your skincare routine shouldn't really have any impact. The third category would be kind of like on the flip side of that. So there's something where we don't have any studies to show that it's bad, but like the mechanism is concerning enough that we don't feel comfortable recommending it without studies. So, and good one for that would be like Botox. So there's a lot of thought that like Botox probably wouldn't do anything if you got it while pregnant, but we just like that would be a bold thing to like, just like widely inject pregnant women with Botox without any
Totally.
clinical studies. And so that's one of the reasons that's not recommended during pregnancy. And then the last is there's some things that we know that just absolutely are not safe to consume or use topically during pregnancy. And so, Accutane is like the number one example of that. Like we know that if you take Accutane while pregnant, you can get serious negative side effects. And so those are kind of the four categories. Most products will fall into the like, we don't know, but we think it's fine, or like, we don't know, but we think you should be careful and just avoid it.
So it's very what came first, the chicken or the egg? It's like no
Yeah.
one wants to test on pregnant women because
Yeah.
of potential negative effects, but then that also results in there's no data to actively
Yeah.
give a yes or no, like this is or is not safe fully, other than isotretinoin, which I'm assuming those things just kind of happen when there are negative effects that have happened when someone's pregnant and they weren't thought of
Exactly. And
a negative
document it
side
now.
effect.
When we get the positive and negative data, sometimes it's usually by accident. It's like, oh, pregnant people use this, and now we realize they shouldn't, or like now we realize they're okay. But yeah, you're exactly correct in that, I get it. As someone who's been pregnant, I was really nervous the whole time. And so I don't think I would have joined a clinical study to test things out. But science is limited because we don't have a lot of data on pregnant women.
It's definitely good that we broke that down because, well, have never been pregnant, nor will I be. I'm a guy, but
You never
I think
know.
it's looking at it in those 4 ways definitely helps break down and understand the intricacies here, since there are so many. So let's first talk about cosmetic procedures.
Yeah. So that
Like
one's quite
what
easy.
you already mentioned Botox, but
Yeah.
is there anything someone can do? Because I feel like the answer is always
The
not
answer is no.
really.
Yeah, it's so
Yeah.
funny. My friends will text me, they'll be like, "Oh, I'm pregnant. Like, I can't do Botox, but what can I do?" And I'm like, "I will see you in 9 months." Like,
Yeah.
cosmetic procedures or elective procedures in general, we're usually pretty hesitant to do them on pregnant women. And that's because there's multiple factors at play. So, one, when we think about injecting something like Botox, we don't for sure know, like, absorption is probably quite low. It probably doesn't cross the placenta. But again, we don't have that data. And so we don't feel comfortable injecting that into the skin. But also with a lot of cosmetic procedures, if we think about laser, a lot of times they have pain. And so pain doesn't come without risk with pregnant one, like during pregnancy. Obviously, pregnant women go through painful things all day, every day. We're a lot more resilient than we think, but it's always like, what's the potential benefit versus what's the potential negative side effect? And so I think pain is a big concern. And then the last thing is, when we think about laser procedures, a lot of times they have healing, like laser procedures or chemical peels, deeper chemical peels have healing after them. So whenever your skin is healing, you're always at risk of infection. And pregnant women are actually immunocompromised, so they don't heal as well. And so we wouldn't want to do something where we do a procedure and now you're at increased risk of infection and you get an infection and then you have to treat that infection. The benefit just doesn't seem to be worth it. Now, once you're no longer pregnant, it's like, come back immediately. I have patients who will come in for Botox like 2 weeks after giving birth. Like they're immediately.
They made their appointment 9 months ago. They're
Yeah,
like,
exactly.
Get this on. You better be free. You better be free.
But I do definitely recommend, I think that your esthetician is your best friend during pregnancy, because on the flip side, I find that going to see your esthetician is very calming, it's very peaceful, it's very soothing. And so, do you adjust things if someone is pregnant?
Well, certainly no chemical peels. I tend to do light peels, or my signature is very massage heavy facials. So there's not really much to swap. I definitely think for other facialists, yes, especially avoiding certain ingredients, but I'm a very massage heavy facial to start with. So I really just like to make sure that there's no actives that, are going to be potentially bad, so higher concentrations of salicylic acid, but I normally gravitate towards lactic acid, mandelic acid, fruit enzymes.
Yeah.
I think that's such a great call if you're pregnant, having that relaxing moment of a facial and massaging the face, making sure you're super hydrated. That can do wonders for someone's, just overall stress levels, and then just how they feel about themselves if they're itching for that Botox appointment, but you're telling them no.
Yeah. A massage
kind
can
of.
do great things for lifting the face. And so,
Yeah.
sometimes that's all you need is just quiet rooms, nice massage hands, and
Totally. But yeah, definitely just swapping a few products here and there for a pregnant client to make sure that there's no ingredients. But I kind of want to dive deeper into the ingredients specifically. So I avoid higher concentrations of salicylic, tend to reach for lactic, mandelic acids. But what are your thoughts on ingredients to avoid, to consider safe? I feel like that's the hottest question I get in terms of, is this, moisturizer I'm using okay? People are always so curious about their day-to-day skincare routines and can they keep using it whenever they get pregnant?
Yeah, I completely agree with you. That's the number one question. And honestly, most cosmetic products are not tested for safety during pregnancy. I feel like you can sometimes tell what's a clinical brand versus what's not a clinical brand, because I find non-clinical brands are it's pregnancy safe. They're just throwing that tell, and I'm have you tested it, or are you okay, cool. In terms of kind of things that we consider to be safe, things that we definitely know are not safe. Retinol is definitely recommended that you do not use during pregnancy. And that's just because retinol is related to Accutane. And we know that Accutane is absolutely not safe during pregnancy. Hydroquinone is recommended to avoid during pregnancy. And then also arbutin is recommended to avoid because arbutin is related to hydroquinone. It actually breaks down to hydroquinone. In terms of, you're exactly correct. Like the alpha hydroxy acids are like a really nice, considered safe space in terms of exfoliation. So you can swap out your retinol for, depending on your skin type, a glycolic acid or lactic acid. I do a lot of prescriptions with azelaic acid. Mandelic acid is also really great. These like more gentle alpha hydroxy acids. Fruit enzymes are great. If you're eating a banana, you can use like banana enzymes. If you're eating a papaya, you can use papaya enzymes. And then vitamin C, as we talked about, is considered safe. And salicylic acid, we've come around with this one. This used to be one of those ingredients that we avoided, but now it's kind of essentially considered fine as long as it's below 2%. And even still then, I say put it in your routine intermittently. So like if you're using a sal acid face wash like every other day, that's considered fine during pregnancy, but you don't want to be using like a high percentage salicylic acid serum on a daily basis.
Okay, good. I'm glad that you validated me not using high salicylic, but I can still be using it. So that's good.
I know it's actually, I like re-looked at the data. There's actually like a new study, like really comprehensive paper that came out in January. So all of this is like fresh, which is really exciting because yeah, we've changed.
I love it. So, all right. So I also want to ask you about acne. I feel like
Yeah.
this is something that lots of pregnant women deal with having breakouts and feeling a bit helpless that, what product can I use to address this? What can these women do if they're dealing with acne while they're pregnant?
Yeah. So the good news is there are now multiple like really high quality ingredients that are considered safe in pregnancy. And this is actually really funny because in dermatology, we've traditionally not used benzoyl peroxide during pregnancy. And then I got pregnant and I went to my OB and I'm like reading through the paperwork and they're like, if you get acne, use benzoyl peroxide. And I'm like, wait,
Wait,
what?
what?
Like, wait,
News to
what?
me. Hello?
Yeah, I was like, this is crazy. Like, we should talk to each other. But in this new paper that's come out, essentially benzoyl peroxide is okay during pregnancy. Azelaic acid, which I said I use a lot of instead of retinols. Glycolic acid, clindamycin, and metronidazole are both prescription. And all of these can actually be helpful for acne and rosacea. So these are all great options in terms, except for the glycolic is too strong for rosacea. But we have a lot of great options for both acne and rosacea during pregnancy, which is relevant because we typically think about people's skin getting better and glowy, but there's definitely a percentage of people whose skin, especially in the first trimester, breaks out a lot. In terms of things to avoid, Thank you for listening to Beauty Curious. We would love it if you left us a 5-star review and subscribe so you can keep learning. Topical retinoids, we avoid isotretinoin, which is Accutane, of course. We avoid topical ivermectin or Soolantra just because we don't have enough data with it. And then we avoid the more kind of hormone-based things. So spironolactone and Winlevi, we would avoid during pregnancy. And I actually just learned this, but in this paper, they actually recommend avoiding cortisone injections, which is unfortunate because cortisone injections are really helpful. But you get benzoyl peroxide, so it's like now you won't need the cortisone injection because you can use your BP.
Good to know and good to have all the updated info and finding out when you go to your doctor's appointments. It's good that everyone's always double checking and updating medical guidelines, year after year.
Yeah.
As new studies and new realities come to.
It's one of those tough things that happens with medicine because we're so siloed. It's like I never read OB literature and OBs never read derm literature. And so it's almost like we've come to the same conclusion separately. It's one of the like unfortunate things about modern medicine, but we got here. So
yay. Another huge concern I feel like I hear is hair loss.
Yeah.
Whenever someone's pregnant, what should pregnant women be aware of in terms of hair loss?
First is pretty much nothing that's designed for hair loss is considered pregnancy safe. Like one technical example is like PRP, but we wouldn't do PRP while pregnant. So it's something you could do like while planning pregnancy, but minoxidil, topical minoxidil, oral minoxidil, not safe during pregnancy. Topical spironolactone, oral spironolactone, not safe. But the really good news is that pretty much all hair loss gets better with pregnancy. Pregnancy itself is a treatment for hair loss. And so usually one of the number one things that people know when they're pregnant is that their hair is thicker and it's longer. I didn't shed one hair like during my pregnancy.
You're like, I have so much hair. Wow.
Yeah, it was I was like, I feel like I'm 16 again. I was like, I didn't know that this was possible. And so it is unfortunate because you have to be off of treatment. But the nice thing is, it's one of those things where pregnancy tends to fix the problem. Even with like autoimmune hair loss, like alopecia areata, because pregnancy is immunosuppressive, it actually, usually any like autoimmune condition is better during pregnancy. So you don't have to do anything.
That's great.
Just do the
Okay,
hard work
so
of making a baby.
yeah, you don't have to do anything, baby.
Yeah.
Like that sounds so simple. So basically, any sort of hair loss treatment that someone might be doing not pregnant is off the table, but thankfully pregnancy itself tends to help with hair loss. And then if you were to have a patient who you were treating for hair loss and then they became pregnant after pregnancy, do you start them back up on, some of the topical and oral treatments, or is like the PRP common? Is that something that you'd kind of do first, or what's normally your kind of transition path if someone was dealing with it before, and then what do they do after?
Yeah, it's a great question. So if someone comes to me and they are experiencing like pretty like early on mild hair loss and they're like, I'm planning pregnancy within the next 2 months, 3 months, because we know that everything that stimulates hair growth takes at least 3 months to start working. So if they're like planning pregnancy within the next 4 months, then we'll say, let's not start anything because it's just actually gonna like make your life more difficult. Let's like meet up after pregnancy, assuming that like the process goes relatively, like hair loss is slow. Most hair loss is slow. So depending on the hair loss. And then afterwards, what we would do is we would get them started on treatment. And so in terms of the treatment options, it depends on if they're breastfeeding or not. So we wouldn't do like the minoxidil or the spironolactone if they're breastfeeding, but we could do PRP. And that's because PRP is your body's own growth factor. So we're not adding anything to the system. If they were breastfeeding, then essentially PRP is kind of like our best case. And then Nutrafol also has a postpartum like hair loss supplement. And then if they're not breastfeeding, we have the whole gamut of things that we can then start them on. So the nice thing is most hair loss, especially when we talk about pattern hair loss, like hormonal hair loss, is very slow. So it doesn't make a big difference if you started today versus if you started after pregnancy. We would just wait until after pregnancy. The one thing I didn't mention is that one thing that can happen during pregnancy is your skin can change. And so there's a lot of like desire to stay on your normal skincare routine. But for me, my skin went from being like very oily to very sensitive. So sometimes there's also just this realization that you actually need to adjust your skincare routine. And then in terms of aging and preventing aging, I have patients who freak out about being off of retinol. Retinol's a long-term game. It's like retinol is like a 10-year, consistency game. So being off of it for a couple of years, like in your 20s, 30s, doesn't make a big difference.
Did you find that after your pregnancy, did your skin feel like it more reverted back from like being more sensitive to how it was oily, or it was kind of in this new state, or it reverted back?
Yeah, I mean, hormones are fascinating. That was the thing. I found them fascinating academically when I was in med school, but like going through the process of pregnancy. So I breastfed for a year after being pregnant. And so my skin essentially like slowly transitioned back to my old skin over that time process, like over like weaning from breastfeeding. But I remember being so excited and being like, I'm going to start my retinoid back. And I used to have the type of skin where I use like Tazarec every night, like no worries, no complaints. And I had to like start with like baby retinol. It was like my like poor sensitive skin. But then, yeah, by the time I was like completely off of all of like done with breastfeeding, my skin has essentially gone back to itself.
Okay, so there's the old wives' tale where women tend to take the beauty from the mother when
Yeah.
she's pregnant, and guys let the mother retain their beauty, which I mean, that I could pick apart in many ways for people analyzing a woman's appearance while she's pregnant and picking it apart. That being said, do you
Yeah.
find anything in terms of hormones and whether a woman is pregnant with a female or a male? Is there anything there in terms of how someone's skin or beauty may be presenting?
Yeah, the data doesn't hold up. And I swear when I like first started practicing, I feel like, "Oh, you have your girl? Is that why you're in my office?" No. It's more based off of like the biggest predictor is if you had hormonal acne before becoming pregnant, you're more likely to have it in that period, in that first trimester when hormones are just skyrocketing. It just means that your body is sensitive. Speaking of Accutane, I sometimes will have patients who have hormonal acne and either they're well controlled or they're not well controlled, but they know that they want to start planning pregnancy a year from now. So not within the year, but a year from now, I want to start planning pregnancy. And a lot of times we actually will do Accutane in that lead up period because Accutane is not safe during pregnancy, but it has no effect on pregnancy before or after you take it. Obviously not before, but it also has no effect on later pregnancies. And so a lot of times people will say like, I just want to get my acne as low as possible because I know I have to go off of my spironolactone. I know I have to go off of my retinoid, and these things are keeping my skin under control. And so we'll do like a 5 to 7 month course of Accutane. They'll be off of it for a couple of months, and then they kind of like go into that planning pregnancy, because the planning pregnancy part is the hardest part because you can't be on all of your topicals, but you don't have those like beautifying like estrogen levels of pregnancy. So yeah, sometimes we'll do that, but there does not seem to be any truth to the girl steal your beauty kind of myth.
I love the pre-pregnancy lead-up plan to help
Yeah.
manage hormonal acne.
It is nice because I feel like, especially my patients, pregnancy is usually like quite planned in terms of, I mean, you can only plan it so much, but people know when they want to start trying. And
Sure.
so it's nice to be able to have those conversations and feel like a little bit in control of a process that's almost completely out of our control.
I learned so much today. Thank you, Dr. Love. And I hope this was beneficial to all of our listeners in getting clarity around what they should be considering and definitely not using while pregnant. And we'll definitely have to have a follow-up conversation about breastfeeding since there are
Yes.
other intricacies and leniencies there compared to actually being pregnant.
Definitely. And I'm sure that like there was something that we forgot to talk about. So like feel free to leave comments on our Instagram with any additional questions that you have about topicals or procedures in pregnancy, and we will answer them.
Thank you everyone so much for listening. See you guys soon.
Great. Bye, guys.
Our DMs are always open.
We're always looking for new show ideas.
Ask us skincare questions.
Let us know what you're beauty curious about
Give us a follow over
at our Instagram at BeautyCurious Pod.
to see snippets from each show. Thanks for watching.